These teams from the National Trauma Centre have been described as the SAS of the medical world. They're usually reserved for the worst humanitarian disasters, and now they're being deployed here to Victoria to deal with the unfolding aged care crisis and to provide some much-needed relief to these aged care facilities, which have effectively been left unmanned, with hundreds of workers either testing positive to coronavirus or isolated, having been identified as close contacts. Assisting them, nurses from both private and public hospitals in Victoria, as well as from interstate, travelling all the way from New South Wales and even South Australia. The ADF too continues to play a major role with its own medical teams and also in providing transport for residents evacuating from some of the worst virus-plagued homes. We know over 170 residents have already been evacuated, dozens more expected today. Private hospitals in Melbourne have had to repurpose entire wards to deal with this sudden influx of patients. As well, all non-urgent elective surgeries in the Melbourne and Mitchell Shire area have been cancelled to free up that valuable bed space, as well as staff numbers going forward. Now, when you look at the numbers, they're not good. Nearly 800 active infections within the aged care system, 769 to be precise. Over 80 facilities have been compromised. Some of the worst affected, including Estia Health in Ardeer, Epping Gardens, and of course St Basil's aged care in Fawkner. Well over 80 infections now, and there are some pretty horrific stories coming out of all of this. Allegations that residents at St Basil's were left in their own filth without being cleaned, were denied food and water, and that family members have been having trouble getting in contact with the facility to find out just what's going on with their parents.
It's a nightmare. It's a crisis. I felt it. I'm living it. So the support that we've had, well, I guess it's been sporadic. It could have been a lot more streamlined, that's for sure. It's been a whirlwind, and as I said, it's been an absolute nightmare.
The AMA is now calling for an urgent risk assessment of all aged care facilities in Victoria going forward.